just wing it. Yeah. I'm Dr. Motykie. I'm a Beverly Hills plastic surgeon and an expert in revision plastic surgery. And I thought I'd take a few minutes today to talk about Demi Moore's latest transformation. A lot of people are talking about her photos from the Fendi Fashion Show. Is that correct? That's why I didn't want to say that. I thought I would take a few minutes to talk about Demi Moore's latest transformation. A lot of people are talking about her because she has a somewhat different look or strange look to her face, and whether or not she's had surgery or what happened to her. And I think there's some important lessons to be learned as far as the standpoint of what plastic surgery can and can't do, as well as how to avoid looking strange after plastic surgery. So I think the first thing to talk about with Demi is the golden rule of all medicine, which is first, do no harm. And I think in the world of plastic surgery, that means not making things look worse or weird. If you do that, then you've kind of broken the golden rule. Most people from plastic surgery want to look like a better version of themselves, more rested, more attractive, and they don't want the extreme, overdone look. In Demi's case, I think one of the things is she starts out very beautiful, so she doesn't need a lot of work. When we're looking at her before and afters, we can see that there is a dramatic change. Now, whether that change some people may feel is strange or overdone, I tend to agree in general that more natural results are better. If we look at Demi before she had this latest change at the Fendi Fashion Show, you can see that she has a very balanced, pretty face that has nice aesthetic features. In other words, her nose, her profile, her cheeks, everything is somewhat in balance. She has a little bit of a stronger jawline, but that's okay because it works with the rest of her facial features. But as we move forward in time, we can see there is a change prior to this where she might have had some work done. Again, you could see that the lower face started to come in and become a little more extreme or gaunt. And that can be a result of either doing several different procedures in the lower face as well as augmenting the upper face. And that probably has to do with a lower facelift that contoured the jawline, possibly a buccal lipectomy, which she didn't really need because she didn't have heaviness in her lower face, as well as adding volume to the upper face or flipping the face too extremely. At this point, it's okay. I don't think she looks that unnatural, but then I think possibly in the next procedure or whatever was done, she may have pushed the limits. And so as we watch her change to the latest photo, we can see now the results have broken that rule. They've become extreme. So if I'm looking at this photo and the change from her other photo, what I'm seeing is, again, this lower part of the face has become more pulled, more extremely contoured and gaunt, and the upper face has become more augmented. And we've now pushed the limits to something that's, some people would say is pushing the realm of strange or unnatural and very detectable. And that is another golden rule of plastic surgery, is that results that you do should be undetectable. In other words, people will look at you and say, wow, did you lose weight? You look good. You look younger, you look rested, but not, whoa, what happened? Something was done here. And in my opinion, her brow has changed as well, and I think that she probably had some sort of a mid-facelift along with this lower facelift that pulled in this direction, and as well as pulled the lateral brow. The problem with that is it didn't address this as well, so she almost has a tired look in the mid portion of the brow while this is being overcorrected. Secondly, in the lower part of her face here, you can see that in this pulling, she's become gaunt here and overstretched. This is giving her this sort of unnatural pulled appearance, and that's a big no-no in the world of facelifts and plastic surgery because, again, it's going to give away your secret. I think also there is a change in her nose and in her upper lip, and my suspicion is this is an upper lip lift along with possibly a little bit of refinement of the nose. And again, in this case, I think that it makes it appear a little bit unnatural. Some people, as we age, the nose will get bigger and plunge down. And if you look back at Demi's nose, you can see that it used to have more of what's called a columella or a hanging columella and a little bit longer length to the nose. And in this case, you can see it's been shortened and the nostrils have changed. So either some sort of a rhinoplasty and or a lip lift was done in that case. Overall, I think the lesson to be learned from this sort of a surgery, again, is to probably seek less aggressive results and maybe more gradual changes. And that way you avoid that extreme kind of shock makeover where people will be talking about you like this, rather than, wow, she's looking great for her age and she's aging gracefully and looks beautiful. And I think that's really what the goal of good plastic surgery is. I think one other point I want to make about Demi or overdone plastic surgery in general is it's definitely something to avoid because it can be something that's very difficult to correct. So once things are overdone or overpulled, it's very difficult to reverse those surgeries. So I think the best way to approach a plastic surgery procedure that you may be looking to do is to search for less extreme results right out of the gate. Start with procedures that will do a less dramatic change so you can see if you like those results. And then more importantly is then as you're moving through that process, be careful that you don't keep chasing more and more extreme results, that you follow sort of your own instinct as well as find a doctor who may say no, because you at some point enough is enough and you want to pull back on plastic surgery, or you can end up having an extreme result. And I think one of the questions that's very common or was people ask is, how does this happen to celebrities? You know, they have a lot of money, they obviously have connections, they have access to the best plastic surgeons in the world. How does something like this happen? It's an interesting question, but I think in my experience, what I've seen in some cases is that some of the more well-known or experienced plastic surgeons will say no. Celebrities or people will come in searching for more extreme results will have the opinion of, no, maybe this is enough, and you're running the risk if you do more that you will end up looking strange or overdone, and we'll tell them no. What will happen is sometimes they won't like to take no for an answer, and they will seek out some surgeons that will actually do the procedure. And unfortunately, in some cases, there are some other types of surgeons, maybe less scrupulous surgeons, that will take the money and do the procedure. So I think in your own mind, make sure you get multiple opinions. And if some surgeons are starting to tell you no, you may want to start to think, okay, maybe this is a time where I'm just going to cool off and take a rest period from plastic surgery and just let myself age a little bit more gracefully for now. In closing, I wanted to give a few general rules to avoid getting extreme plastic surgery or unnatural results from surgery. And I think overall the first rule is avoid trends, because things that are trendy today or that are attractive today may not be in 10 years. And some of those things can't be undone. So try to avoid doing trends or unproven procedures. Secondly, try to avoid going and getting extreme results. Because when we push the extremes of plastic surgery, that's when complications occur, people start to look strange, unusual, and I think that's not what most people want out of plastic surgery. Most people want to look more attractive, rested, just like a better version of themselves, and not completely different or strange. Thirdly, always seek a surgeon that is board certified in the procedure that you are personally interested in. The reason is you want to find somebody that has experience and skill set to give you those natural, aesthetically pleasing results without overdoing your surgery. And then I think in the very end, in this specific case, like Demi Moore's case, where some extreme results have happened, if that's personally happened to you, my advice is to seek out not only a board certified plastic surgeon, but also somebody who has experience and is an expert in revision plastic surgery, because it is a totally different type of procedure, and they can guide you through the process of gradually reversing these type of results, and also what is possible to make you look more natural and beautiful once again. If you have any questions about Demi Moore's possible surgery or anything about revision plastic surgery, please leave those questions or comments below.